Oh, there are so many yummy vegetarian options out there. You could try like lentil soup, veggie burgers, tofu stir fry. The possibilities are endless. All right, let's dive right in with our first case. Type 2 respiratory failure. So, what's the big idea here? It's all about hypoventilation. That's just a way of saying the lungs, well, they just aren't moving enough air. What this really means is that the body can't clear out carbon dioxide like it's supposed to. And when that happens, you get this dangerous buildup of CO2 in the blood that's called hypercapnia. And of course, you're also going to see low oxygen levels or hypoxemia right alongside it. Okay, so how do we spot this? Well, it shows up clear as day on a blood gas analysis. You're looking for two classic signs: a low PaO2, that's your oxygen, and a really high PaCO2, your carbon dioxide. It's that high CO2 that's the real troublemaker here. It makes the blood acidic, leading to what we call respiratory acidosis. So, let's think about how this is supposed to work. In a healthy lung, gas exchange is, well, it's a beautiful thing. CO2 just flows from the blood into the tiny air sacs, the alveoli, and then, poof, we just breathe it out. Super simple, super efficient. But in type 2 failure, that whole system breaks down. It's like the exit door for CO2 gets jammed shut. Because of the hypoventilation, that CO2 gets trapped and its levels in the blood start climbing and climbing to dangerous levels. All right, that brings us to our next case. What kinds of things cause this failure? Well, the textbook example, the one you absolutely need to know, is chronic bronchitis. It's just a classic cause of long-term CO2 retention. So here's the high-yield point. In chronic bronchitis, the airways are super narrow and clogged with mucus. This physically blocks ventilation, and that's why CO2 builds up. Now, don't get this confused with early asthma. In an acute asthma attack, patients are actually breathing so fast they blow off too much CO2, so their levels are low. Just remember, chronic bronchitis is a plumbing problem. The pipes are blocked. Okay, moving on to our third case. We know what's happening on the inside, but what does a patient with really bad CO2 retention, what we call CO2 narcosis, actually look like? Let's talk about the clinical picture, what you'd see standing at the bedside. Believe it or not, pretty much all these signs trace back to one single fact. CO2 is a powerful vasodilator. It opens up blood vessels. In the brain, that extra blood flow is what gives you the headache and makes you feel drowsy. And all over the body, that's what causes that classic warm, flushed skin. And this leads us to a really, really important clinical pearl. The patient with CO2 narcosis is warm and flushed, right? That is the exact opposite of a patient in circulatory shock. Someone in shock is going to be cold and clammy because their blood vessels are clamping down. Big difference. All right, let's switch gears completely. We're moving from the lungs to the mind. Our next case is delusional disorder. And the name kind of says it all. It's about a fixed false belief that just won't budge. So here's a typical scenario. You have someone who is absolutely convinced of something that's not true. For example, they believe their partner is cheating on them, even with zero evidence. But, and this is the key part, outside of that one belief, their life is totally normal. They go to work, they pay their bills, they function just fine. This is delusional disorder. The diagnosis hinges on that one persistent delusion. It's got to be there for at least a month. But what's crucial is what's not there. No hallucinations, no disorganized speech, and no major crash in their ability to function day to day. So you might be thinking, wait, how is this different from schizophrenia? The number one differentiator is functioning. With delusional disorder, the person's life is pretty much intact, except for the part that's touched by the delusion. With schizophrenia, you see a major hit to their overall ability to function, plus all the other stuff like hearing voices or having disorganized thoughts. Okay, case number 5. Let's get into prenatal screening. We're going to break down the quad screen for Down syndrome that's done in the second trimester. Now, when we're looking at this test, it's not just about the numbers from the lab. To really understand the risk, you have to combine those results with one really important piece of information about the patient, her age. So what are we looking for? Well, the classic pattern for Down syndrome is pretty distinct. 2 markers go down, AFP and estriol, and 2 markers go up, HCG and inhibin A. A little memory trick: the H and I in high risk, H for HCG and I for inhibin A, are the ones that are high. And I can't stress this enough. Those lab results, by themselves, don't tell you the whole story. They are pretty much meaningless on their own.
you have to plug in the maternal age, which is a huge risk factor all by itself, to get the real final risk estimate.
All right, let's wrap up with our final case. This one is all about the heart's electrical activity, specifically the connection between your calcium levels and something on the ECG called the QT interval.
So, when you see a prolonged QT interval on an ECG, that's a red flag. It means the heart's ventricles are taking too long to recharge between beats. This puts the patient at risk for some really dangerous arrhythmias. We're going to look at what causes this and, more importantly, what doesn't.
And man, the list of things that can cause a long QT is, well, it's long. You've got electrolyte problems like low calcium, hormone issues like hypothyroidism, and a whole bunch of medications that can do it, especially drugs that mess with the heart's potassium channels. So let's focus on calcium. When your calcium is low, hypocalcemia, it slows down that whole recharging process in the ventricles. And on the ECG, that delay shows up as a longer QT interval. Simple as that. But here's the twist, and this is super high yield. High calcium, hypercalcemia, does the exact opposite. It actually speeds up that repolarization phase. So what does that do to the ECG? It gives you a shortened QT interval. So here's the exam pearl, the one thing you need to burn into your brain. Low calcium makes the QT long. High calcium makes the QT short. It's an inverse relationship. And that means hypercalcemia is the one condition on this list that will never cause a long QT. In fact, it does the opposite.